the most common conditions we treat at New England Endovascular Center is end-stage renal disease, which occurs when a patient's kidneys are no longer functioning and a patient has to undergo dialysis. There are various forms of dialysis, most commonly broken down into hemodialysis, which involves the exchange of blood, as well as peritoneal dialysis. With hemodialysis, blood is removed from a patient's body, it's run through a machine, and then it's placed back into the patient's body. And there are various ways to accomplish this, both with a surgically created fistula as well as with placement of catheters. Patients on dialysis will commonly have a surgically implanted fistula or graft to serve as the access point for their dialysis. This is sort of considered the gold standard for dialysis access, but unfortunately these accesses are prone to failure, either through narrowing or even blockage of the circuit. Fortunately, when this occurs, it can typically be fixed without surgery, and we regularly perform these procedures in our office. The procedure involves performing a fistulogram, where we place the patient on their back, most commonly with their arm extended, as this is the most common location for a fistula or graft. Once we do this, we insert a small catheter into the fistula, and we study it by injecting a contrast dye that we can see on live X-ray. This helps us identify the problem area. When we go to fix it, we typically use a balloon to stretch open the problem area. This procedure allows the fistula to function properly again, and the patient can return back to dialysis. It's a low-risk procedure. It's also a fairly quick procedure, with most of these requiring less than an hour to perform. Peritoneal dialysis is a unique form of dialysis that can be safely performed at home. This has some real lifestyle advantages because you don't have to go to a dialysis center 3 times a week to receive your dialysis. With peritoneal dialysis, we place a small catheter directly into the abdomen. The catheter is equipped with lots of side holes near the tip. This catheter allows us to infuse a dialysate, which is a fluid that equilibrates with the small blood vessels lining the abdomen. After the fluid sits the required amount of time, it's then drained. So it's basically involving an infusion of liquid into the belly, which can be performed while the patient is sleeping, and subsequent drainage. It's a low-risk procedure that typically takes under an hour to perform, and it's considered a long-term access for the patient.